Giving analgesics is about controlling a stress response. And if you lived in a fight and flight response 24 hours a day, you will die. And analgesics allow us to manipulate that stress response and make it far less catastrophic for the animal. And then they may need their antibiotics, for example, some other treatments that are there. And if you have animals with chronic disease and they're on regular therapy, keeping that routine is absolutely vital. So if they have heart disease and they're on something like pimibendin or furosemide or one of the ACE inhibitors, for example, keeping that system going is very, very important because the stress of anesthesia can make their heart disease a lot worse.
Welcome back to the Paws Effect Podcast. I'm Dr. Kara, your host. Today, we're addressing a critical aspect of veterinary medicine, anesthesia in pets. Understanding anesthesia goes beyond the surface. It's a complex, multifaceted process essential for a wide range of procedures. Joining me is Dr. Kenneth Joubert, a specialist in veterinary anesthesia, to explore why anesthesia is more than just sedation and why it requires careful consideration of each animal's unique physiology and why there may be costs involved. We'll delve into the technical aspects, discuss the importance of individual factors like age, breed, and health status, and answer some of the most pressing questions pet owners have about anesthesia. This conversation aims to equip you with a deeper understanding of the rigorous standards and protocols that ensure the safety and well-being of your pet during these procedures. Welcome, a very, very warm welcome, Dr. Kenneth Joubert. I'm very, very grateful that you've taken time out of your incredibly busy schedule to come and chat about anesthetics in our dogs and cats. So welcome.
No, it's a pleasure. Thanks for inviting me. It's always fun to do these things, and hopefully we can discuss some interesting things and help owners out there.
Absolutely. So I know as a vet that there is more to an anesthetic than just knocking out a pet for a procedure often. And I want to discuss so that owners and listeners can really understand what you do very frequently and what owners don't hopefully have to experience too frequently, which is having to bring their pet in to a practice to undergo an anesthetic, because there is a lot of fear, whether it's a financial concern or fear for the well-being of their pet around anesthetic. So perhaps you can unpack some of these myths and concerns for pet owners and help them understand the process a bit better. So can I start off by asking you to clarify what is an anesthetic? Let's start at the very beginning.
Yeah. What is an anesthetic? So we always think it's drugs. And I'm starting on a very obscure course here. But we often think an anesthetic is all about drugs. And it actually plays a very, very small role. If you think about anesthesia and when patients die, or when things go wrong, I know it's a pretty negative point to start at, but most things actually go wrong after an anesthetic. Once we've given the drugs and the patient's waking up. So based on statistics, and this comes out of studies that they've done in small animals, so it's the confidential inquiry into perioperative small animal fatalities, we know that almost 50% or more patients actually die during recovery. So part of anesthesia is actually looking after patients. And people, to start there, it's about looking after these patients, looking after their physiology and so on. So what an anesthetic agent is it's a drug or a combination of drugs and medicines that we give to make a patient unconscious. And this is all about being humane. When we do procedures that are painful on animals or even people, you want to keep them comfortable. And there's not a single drug that's going to do that. So we often give more than one drug to do it. So if you look at the drugs that make you go to sleep, you can call it a hypnotic, but they're the sleep drugs. And many people will know things like propofol, Michael Jackson's great drug, for example, that's there. And it makes you go to sleep, but it doesn't have pain-killing properties. So we need to give a painkiller, for example. And that we may choose an anti-inflammatory to go with it or an opioid, for example. It also depends on the animal itself. We get some animals that are really calm and relaxed and other animals that are stressed. So sometimes we want to give them something that makes them less anxious and less stressed before that procedure. So we use these combination of drugs to give the animal, the pet, a nice, calm, relaxing experience and to keep them pain-free. So that's the most important goal. The first goal is to make sure a patient is pain-free. And they have no memory of the procedure that was done on them, and that we achieve by making them unconscious. That's there. But the biggest important thing is actually to look after that animal under anesthesia. And that's my biggest role. People say, what role do drugs play in the whole story? To give you the stats for it, what we call pre-medication, but the drugs we may give before the anesthetic or with the induction, making them go to sleep, only accounts for 1 or 2% of the problems. Everything else happens after that point. And it's actually about looking after the patient and looking after their physiology so that we can keep everything functioning normally whilst they're asleep.
So that's a great explanation and really clear. Owners are often asked to bring their pets in before a procedure for a clinical examination, or for the vet to at least discuss some things. And there are a few things I want to ask you to provide the listeners with some clarification on. The informed consent, so the signing of that scary document, but also the benefit of having an animal and having the ability to run tests beforehand, or to do a clinical examination, or to explain to the owner and to mitigate some of the risks potentially associated with the procedure and the anesthetic itself. So can you give your view on how important it is to have that time with the pet and the owner before the procedure?
You're going to get some of your most important clues about what we call anesthetic risk, if I can put it to you that way, by actually talking to the owner. And if you look at one of the major determinants, it's going to sound a bit weird, but your ability to run 400 meters in less than 6 minutes, just so that you know, or climb 2 flights of stairs and be out of breath, it's exercise. Can that dog actually exercise, or people do pass those tests, actually has a significant impact on anesthetic risk. And I can see a dog in a cage, or I can send one of the staff to go and run 400 meters in 6 minutes if they're keen to try and see it. But often you can ask owners questions. What's the dog's activity like? Does it go on walks, for example? How far does it walk? Does it run to the gate after the postman and it's almost dead by the time it gets there? Or is this cool? I'm now ready to go and it comes on a 10K walk with me every day. Because what exercise tolerance tells us, or the ability to cope with that exercise, actually tells you about how much reserve there is in your physiology. And that we often don't get, by the way, from looking at a patient. Yes, if they're sick, we're going to notice it. So that type of history actually becomes important. And I'm sure there's some people out there with brachiocephalic dogs. They don't cope in heat, for example. They have airway problems, and that's one of their big issues. So how are they coping with the airway? And how do I get that information? I ask the owners, does your dog snore when it sleeps? What noises does it make? And then I can get from a history, which you're not going to get entirely from a clinical exam. So it's important to have a good clinical examination of that patient and to get that history from it. Sometimes I see dogs where it's been in the clinic for years, and so everybody knows what's going on, but it's not always the case. They may give other medications, other supplements, herbal remedies, for example. CBD is very popular amongst people, and those can lead to drug interactions. So just so that you know, you can go and research it on the FDA, the American FDA database. But sometimes herbal supplements, which people consider innocuous, not really a drug or a medicine, they don't actually tell you that they're taking it. But there's 7 class 1 withdrawals against herbal substance, or notices against herbal substances, because they actually cause death when combined with some other drugs. And people don't always tell us that type of information. And you've got to get that type of information. Even if you see a dog regularly, they may not tell you everything that they give. And I know many people believe CBD or THC, however you want to look at it, and whatever you want to give is very safe. But it has drug interactions. We know it does. It enhances, for example, the penetration of opioids into your brain. And that's one of the amazingly interesting effects it has of how it does this. So it was first documented, by the way, in the hippie era with phencyclidine, LSD, those type of drugs, the hallucinogens, that actually it made them, or appeared to make them, more potent. And they discovered it actually enhances their drug penetration into your brain, for example. And that can lead to changes. So now you give an opioid with it, which we give for analgesia, but you could be changing how it affects your dog if you don't tell the vet, and people aren't aware of it, And I know doing horse anesthetics, for example, reserpine is very popular for trying to quieten horses down. But it influences how their whole adrenergic system. And I could figure out horses had it based on what their blood pressures did and their heart rates did under anesthesia. And then I have to go and say, but are you giving this horse reserpine afterwards? And they say, yes. Oh, okay, that explains the whole issues. But it can lead to complications.
Fascinating.
And people don't always tell you. So that's the first part is doing a good clinical examination. And usually what happens in a lot of practices, they'll combine that with blood tests looking at kidney function, liver function, for example. And there's always two sides to that story, by the way. So the first thing is us and humans in the insurance industry. Every time we change our life insurance, they bleed us to death. They try to kill us on a treadmill and run us to death. And they do all these tests for us. And then they say, oh, you're healthy enough. Now we'll insure you because you survived the testing. And then they know their risk's low. But it identifies diseases in earlier management. And anesthesia is a convenient time to do it. And it's important to actually do that on an annual basis. As your animals and your pets get older and older, doing routine screening for diseases is absolutely vital. So anesthesia is a time. People often ask me, does it improve safety of anesthesia? And in actual fact, the literature is not that clear on it, believe it or not. It doesn't show necessarily safety. But if you find something clinically wrong with the patient and the history points to a clinical disease and you do a test in response to that, that offers benefit. Okay. And part of the reason is, you do a routine screening test. Oh, everything's normal. Well, it didn't change risk, for example. But now you get ahead and the owners say, gee, my dog or my cat drinks a lot of water. It's peeing a lot, for example. And you identify renal disease and you start managing the renal disease earlier. That has tremendous implications. And that also depends what we're doing. And that's the type of thing you can discuss with the owner at that point in time. And it's actually very more convenient to actually say, come in a day or two beforehand. Let's do the screening beforehand. Because sometimes what happens is an animal comes in, it's an old cat, it comes in for a dental and we discover renal disease. And people have now made a plan to do this. And now the owners are stuck in this thing, do we investigate the renal disease? Do we do this? It's meant to be here for a dental. And it actually creates a lot of pressure both on the staff in a veterinary practice, but also on the client to say, what do we do now? Where do we go? Whereas if you've sorted all this out in advance, it actually makes the process flow. But if you identify a disease, the best thing to do is optimize that management before you do the anesthetic.
Okay.
And that also depends on what's wrong. If it's coming in for something that's, I always call them elective procedures, we can do it today, we can do it tomorrow, we can do it next week, next month, next year, it doesn't matter. But then we've got also things, actually we need to do this. I'm just going to say, a tooth root abscess that's draining out through the nose, that's sitting there. It's something that we can't leave.
Big laceration.
Big laceration, you could argue you could leave it, by the way.
But shame.
But something that needs things, if it's a big laceration, you need to save skin, for example. The quicker you get it back onto a vascular bed, the better it is. So you've got to weigh up those things. And that's a discussion. And there's sometimes not always an opportunity to do that. And having that pre-anesthetic type consult is a time to do it. So in the human side of things, certainly they always ask you to go beforehand. Often you would see a nurse or a nurse practitioner that's there. They do all the basic tests. They feed the information on, and then they work out where they're going to go on from there. And that type of screening, I think, is incredibly valuable. So it helps us in a decision-making process of managing a pet through a process. It's the way that I would describe it, that it is there, looking at their health, the overall well-being of that animal. And it's also about a time to discuss, and I always say that these things, because sometimes we're doing procedures on animals that have high risk, for example, or we're removing tumors, for example, and things can go wrong. And the question then is, do we do everything to save the animal's life? And this is going to sound like a little bit horrible in a way, but do we do everything to save their animal? Or if something really goes wrong, do we say, that's his time, do no more? And the reason that it's important to have this discussion, we have terminal diseases. And sometimes, for example, we've got a patient who's dying, they've got a ruptured tumor in their abdomen, they're bleeding out. And if we don't stop that bleeding, they're going to die quite quickly. But their tumor and their tumor disease is actually quite advanced that we can't cure them anymore. Now, if something goes wrong, do we try and save him, or do we just say, well, let's let it allow to follow a natural course? And there's no right answer to it. And that's a discussion that you need to have with the owner. Where do they sit with this? And you've got to have those times to have those discussions. And it's an important discussion to have. And that they participate in that process.
Hello, I'm Dr. Kara, a veterinarian and the host of the Paws Effect Podcast. Our show is all about enhancing the lives of pets by providing reliable, science-based advice and engaging in discussions with experts in veterinary medicine, pet nutrition, and animal behavior. As a professional with years of experience in both the UK and South Africa, I run a 24-hour veterinary hospital and an online pet store. I'm also pursuing a master's in animal nutrition and consult for UltraPet, a local veterinary-grade pet food manufacturer. My passion lies in sharing knowledge and helping pet owners make informed decisions about their pet companions. The Paws Effect podcast is rapidly growing, attracting a dedicated and engaging audience of pet owners who are passionate about their pets' health and well-being. Our listeners trust us for credible, informative content that empowers them to provide the best care for their animals. We are looking for sponsors who share our commitment to pet health and who want to reach a highly engaged and expanding audience. Partnering with us means aligning your brand with trusted and influential content that resonates deeply with pet owners. As a sponsor, you'll benefit from high visibility on a platform that is used for multiple purposes, including educational content, product recommendations, and community building. We offer various sponsorship packages designed to fit your marketing goals and budget, ensuring that your brand gets the reach and the impact it deserves. Join us in making a difference in the lives of pets and their families. Let's work together to bring valuable insights and quality products to our passionate audience. If you're interested in sponsoring the Paws Effect podcast, please get in touch. I look forward to partnering with you. Before we resume our conversation, let's address a vital aspect to pet care, your puppy's nutrition. Allow me to introduce you to a personal favorite, UltraPet's premium recipe for large breed puppies. I've relied on this for all my dogs, and it's truly made a difference. This puppy food offers a balanced blend of nutrients with 30% protein, 15% fat, and 4% fiber, supporting your companion's growth and development. Featuring a delectable chicken and rice flavor, UltraPet caters for even the pickiest eaters. It's available in 2 pack sizes, a 8 kg and a 20 kg, and it's suitable for households of any size. What sets this puppy food apart is its meticulous formulation, developed by experts for a complete and balanced diet. It includes essential vitamins and minerals and prebiotics for a healthy digestive system and a robust immune system. With high-quality protein sources and essential fatty acids, this food promotes muscle development, healthy skin and coat. Plus calcium and phosphorus strengthen bones and teeth. UltraPet has mastered the balance between nutrition and taste, making it a top choice for puppy food. Find it at your local pet store and give it to your companion for the best start. Your pet will thank you, and you'll appreciate UltraPet's commitment to optimal nutrition. Now, let's get back to our conversation. Let's talk about things like body temperature. So, I know we're talking the difference between a sick animal and the difference between needing a procedure immediately or elective. But with an animal that comes in with an elevated body temperature, what are the kind of thought processes as owners? What is the kind of advice that vets are then giving in terms of the considerations within an anesthetic protocol?
Oh, now there's a myriad of thought that goes through my head. It also depends on the breed, for example.
Yes.
So I'll just use the brachiocephalics because dogs cool their bodies through their airways. And a brachiocephalic has a compromised airway, and they get warm, for example. They put more and more effort into their airway becomes more compromised, they heat themselves up. And that can become a life-threatening situation. Although they're not sick, they are. So I always look, what is the ambient temperature? I mean, we're going into spring, it's getting warmer down here, for example. If it's the middle of winter and it's cold and the dog's temperature is sitting at like just above normal, that to me is a bigger red flag than in the middle of summer when it's 30-odd degrees outside, it's hot, a dog comes in, the temperature often a lot higher. So there's always a context to what is that that temperature that is there. And a raised temperature can be there just because of now what we're talking about, environmental heat. It's had a hot car ride, etc. And that's easy to determine because you just let it settle down in a cool environment and the temperature drops quite quickly. They cool themselves and then you know, okay, well, that's a minor. But fevers happen with diseases. Babesia, for example, so biliary fever that dogs get. So, okay, your temperature is sitting at 40. Where's the infection? Sometimes it'll be there because that's why the patient is there, which is fine. You have an understanding of it. But if this is an elective spay and it's running a temperature, what's wrong? Why is it there? You know, cats, for example, with respiratory disease, for example, can run fevers. Looking for that, I think anybody who's had a kid will realize that when kids go to hospital, oh, it's got a cold. Actually, no, come back another time. They'll just kick you out the back door and say, when they better, bring them back. Because if you've got a viral infection, for example, an anesthetic compromises lung function, and in actual fact, for a significant number of hours after an anesthesia, which makes you more prone to an infection. So now you take a mild cold, which you would have self-cured in 5 to 7 days and been back to yourself, and you turn it into pneumonia. And that's bad because that was preventable. You know, if you absolutely have to do what you're doing, well, then you make a different decision. But people are at least aware of it. So, yes, you've got to do it. It's part of a basic clinical examination. Look at what the temperature is and see how it goes.
And sometimes we're sending information out to owners ahead of time, including, and I want your view on informed consent, but we're sending information out to say, you know, Fluffy's due for procedure tomorrow. These are the things we'd like you to do. And one of them is obviously restricting food after a certain time and water, perhaps. Can you give us the reasons behind why we're advising?
So the first thing is when you have an anesthetic, there's always a risk of you vomiting. And especially if your stomach's full, that risk actually increases quite a lot. So the reason that we often say remove food, feed them their meal the evening beforehand, for example. There are some exceptions to it, which I'll tell you about. But the reason is so that they have an empty stomach, which reduces it. So the first anesthetic death was a Greener, Henrietta Greener, the first anesthetic death that in actual fact happened. She dies of aspiration, by the way. So she has an ether anesthetic. This is in the 1800s. And she aspirates and she dies because of that aspiration. So it carries a very, very significant risk. And we can reduce that risk that is in actual fact there. And that's why we starve animals, because it's a simple thing to do and it prevents something else from happening, which is bad. So that's why we do starve dogs generally from the evening before, and some people say 10 o'clock in the evening if a dog needs a snack or something like that it is there. We do have groups of patients where we do change that. And the first one is, for example, puppies and kittens. They need to eat regularly. So you can't starve them for a long period of time. But if they're suckling and drinking milk, for example, we know within 2 hours the stomach will clear. So we can say, well, when you get up in the morning, that's when you're not going to give them anything else to eat. We're going to do it first in the list, for example, and you can plan around it. So they patients who are vulnerable if we starve them. So we want to avoid that. But you can often use clear fluids, by the way. So and people always say apple juice, but a clear fluid, you can do it. The same thing with water. So water can fill up your stomach and therefore it sits as a liquid. But a liquid is actually cleared a lot faster from your stomach. So normally if you have a bottle of water and you drink it down within about 30 to 60 minutes, most of that water's gone and all of it, 90% of it will be cleared in 2 hours. So I really don't mind dogs or cats having water overnight. But if you've got cats, for example, with renal failure, they're going to dehydrate if you take their water away from them. And especially if they have advanced renal failure, that carries a risk. So I always tell them, well, leave them with water overnight. And when they come to the clinic, we put them on a drip to maintain their fluid balance because they're going to lose a lot of water through their kidneys. So people need to be aware of what's actually going on in those animals. And sometimes we will change that advice. Diabetic patients as well, we manage them with insulin and food. And it's important to get that whole system going. And if we've got stable diabetics, it's sometimes better to plan your anesthetic when it's convenient for what's happening, because you disrupt it. It can take a while to get them back into having stable blood glucose levels again. And if the people wake up at 5 and they feed it at 5 and they give it its insulin and everything works like that, well, do that, and then we'll do the procedure at like 2 o'clock in the afternoon. So you delay the whole procedure and you put it right at the end of the list, because at least that way he gets his food and his insulin, and they work. It works well for the dog in terms of their management. I don't have an objection if dogs or cats are on chronic medicine and it's easy to give them their tablet and a Vienna. Sorry, I didn't say that. Or anything like that. Yes, give them their little Vienna with the pills in it. At least they get their medication. If they've got heart disease, etc., and that's not going to cause a major problem, but it's having a massive meal. And what people miss is they'll take away one dog's food, and then it'll go and eat the cat's food or somebody else's food. It'll find food somewhere. And so when we're giving people instructions to starve patients can actually be quite an interesting exercise. I've had dogs who know exactly where to find food. They go to the stables, they go to the tack room, they go to all different places because they know exactly where the food things. So the owners don't feed them, but they get food. So, like in those situations, saying, well, if that's the case, what actually happens? Animals can still get access to food. So it's important to follow those instructions because it just improves safety. That it is there. It removes one, or we can avoid one issue we don't need to worry about. So starving patients is actually quite important. And usually I just say remove water the next morning when they come to the clinic. And that's usually more than enough time for liquids. Informed consent is important.
The reason I'm asking this is because often people think it's associated with anesthetic risk, or from my experience within my practice, they go, is this because they're likely to die under the anesthetic? They feel that, the small print is associated more with an anesthetic risk than the surgery. And it's the informed part that I'm always, because often that is cost, informing them of the cost associated with it. But they feel that that form is based really on anesthetic approval and risk.
So, look, people always ask me, how do you avoid an anesthetic death? The easiest way is never have an anesthetic. And that's not possible. Yeah. And unfortunately, everything carries risk. And, if you look at anesthetic mortality, people drive to your clinic. Sorry, that's true. What's the risk of having a car accident? People fly all the time. It has a risk associated with it. Everything we do, in actual fact, carries risk, that it is there. And even medicines we give, for example, and I've seen some devastating reactions to medicines in my career as well, that are there that can become life-threatening. And we give it out of intention. And some patients who have cancer, for example, some of our chemotherapeutic drugs can have rapid life-threatening complications. So every procedure does carry a risk. And the first principle of medicine, by the way, from ancient Greek philosophy is do no harm. And we should do that. So everything we think, and part of informed consent is actually discussing that so that the client or the owner knows, the pet parent knows what we're going to do and why we're doing it. And it's part of that discussion is a risk-benefit discussion that is there. And we need to have that discussion to say, your cat has a draining carnassial tooth abscess, so one of its teeth has got infected. It is sore, it is painful, it makes your cat not eat, it makes their life miserable. And it's not fair to leave them with that pain and discomfort. And we can fix that. We can take that tooth out, and therefore we can improve that cat's quality of life. And that is part of that discussion, is to say, this is what we're doing and this is why we're doing it. And it's about understanding that. And I think it depends how people word these informed consents, And sometimes we can do it very bluntly, unfortunately. And it says, oh, your animal may die. And people ask me, what is the risk under anesthesia? And this is a statistical discussion. But if you look at risks, there's really two options. Either the animal's alive or it's dead at the end of the day. So it's actually a 50-50 chance. But now what we're talking about is the chance of one side of that coin coming up over another. So in actual fact, anesthetic risk is a probability of a probability. So it's actually not a direct probability. And that, if we look through the literature, is anesthetic death happens at a rate of about 1 in 1,000 in animals undergoing elective procedures, roughly across the world. Roughly, if you work that out, it's just over 1 in 1,000. So the chance of one coin coming up is once per 1,000 flips. So in actual fact, the risk is then 0.1% if you look at it in a population. But we deal with owners' animals. It's their pet. And we know what happens in the population. But in an individual pet, it can be quite difficult to predict that it is there. As I say, doing a good clinical examination is part of that. And if we find problems, it's about saying, where do we go from there? So that informed consent, I think people look at it as, it's all about money and it's all about risk, which part of it is there. But it's also about a joint decision-making process, about saying, this is where we're going with the whole health of your animal. And I think that's important for people to realize. It's not about it's a record of a discussion of saying, this is why we're doing what we're doing and why we need to do what we're doing. And this is how it's going to benefit, because there are benefits from it for our patients. And we improve qualities of life. We can cure diseases and conditions. You take a fractured leg, you plate it, you fix it. The dog can carry on for a normal life for the next 20 years, however long it may live. And that's benefits that are out there. And then, as I say, unfortunately, everything has risk that we do. And sometimes we don't think about that risk. But anesthesia often gets this defining point that this is the risk that is there. And it shouldn't be about that, because it's not just the anesthetic. And as I say, the post-operative period is most probably more important than the operative period itself. But it's also that whole recovery journey, depending on what we've done. So there's a whole long recovery story that still needs to go on afterwards. You repair a fracture, it can form a non-union, for example. Things can go wrong. That could get an infection. I can go through a whole long list. It's not always possible to discuss all these things at the time with the owner, but there are risks associated with everything, both with the procedure and the anesthetic that we may do.
Absolutely.
And it's about having that informed consent, about having understanding. And I always view it as rather as a discussion about what we're doing, why we're doing it, where we're going, then rather than just saying, this is a form that you need to sign, right, here's the amount that you pay me, and here's the risk. Because it's very difficult to actually predict that risk. A population we understand, but actually an individual we don't understand very well.
Absolutely. Now I'm going to give you a couple of very simple case scenarios. And you'll see where I'm going with this, hopefully. So I have come across situations where probably a little sort of misunderstanding with the owner, I'm hoping, in that they have brought an animal to us with a laceration, nice simple one for you, and they've said, I don't want it anesthetized. You need to do it conscious. My son's a rugby player. He had a laceration the other day, and the doctor did it. Why? I don't understand why. So something as straightforward as that, the owners are sometimes struggling to understand why we have to anesthetize their animal in order to manage things like this. And I'd love your explanation or how you would approach this scenario.
So the one thing is cooperation. People you can talk to. And you can say to your son, you had a rugby accident, you've got a cut there, we're going to inject some local anesthetic, hold still and lie still. And you do get some animals that are far more amenable to it, by the way, and you get some animals that are never going to do this, okay, that it is there. And so we lack that cooperation. Teeth cleaning is another good example. You brush your teeth every night, you go to the dentist, the oral hygienist says, open, turn this way, turn that way. No, keep your mouth open. They moan at you the whole time, but they can talk to you and they can clean all your teeth, inside and outside. Some dogs will even battle to open their mouth. How are you going to clean the inside of their teeth or between their teeth without having an anesthetic? And they're an anesthetic safer because we can protect their airway. We've got the same instruments that they use in humans to clean their teeth. So you've got water that cools down the little scaler that you use, etc. And all those things are necessary, but you can actually protect their airway. And that forms part of that thing. And I think the other thing people don't realize is they often think, oh, sedation's safer. The actual truth is it's not, just so that you know. Sedation is actually not safer than anesthesia. And there's a number of factors that go into it. But one of the things is you don't protect the airway. We didn't learn from good old Greener in 1867 or whenever it was. Protecting the airway actually becomes vital. And by the way, that's where the ET tube basically gets its reputation as a gold standard for protecting airways, is from that period, because that's the way that you can do it. So sedation is often not safer than anesthesia either. But you've got to get that cooperation. We do painful things sometimes. If you take a laceration and you're going to flush it and clean it out properly, that it is there, you can tell the person, oh, it's going to be sore. A dog may experience that pain and they bite you. So then you get an injury, or the vet gets an injury, or the staff get an injury. Sometimes owners get bitten in those type of exercises, which is avoidable, by the way. And you certainly have to protect people's safety, by the way. People are rank far higher in terms of safety in any disaster or anything. Animals are low down on the list to be saved. I know it looks sad, but they'll save human lives before they save animals' lives. But you've got to look after that, and you've got to make it a comfortable experience. So holding an animal down is stressful for the animal, and it's stressful for the staff that deal with it. You know, we've left the errors of vivisection, but tying an animal down and trying to hold it down when it doesn't want to with the cooperation is stressful for those animals. And that changes their whole attitude for the rest of their lives to a veterinary consult, for example. They may never want to ever come into because of that experience. And I love cats because cats get food aversion quite quickly. So if you try and force feed them that food, they're never going to touch that food again. And if we do horrible, nasty things to patients, they remember that. And our analgesia and the drugs that we give, even if it is a sedation, makes that a far more comfortable experience for that animal. And it makes it a far more comfortable experience for the staff that are involved with it. Because it's not fun. We're not all sadomasochists who enjoy holding animals down and doing mean things to them, because procedures are sore and painful. So you talked about anesthesia, sedation, but it's actually about providing analgesia. It's about providing comfort for that patient and making them feel relaxed. And we run puppy schools and a whole lot of things to get dogs used to coming to a veterinary clinic, used to being examined, for example, so that it is a more pleasant experience when they come for their clinical exams. We spend a lot of effort, the food companies spend a lot of money on it, trying to encourage these type of things, because it's better for those animals if they're used to it in the environment. And here we just go and do something mean, which can stick in their memory for years and say, cool, I'm not going back there.
Absolutely.
That is there. I always say one of the worst fates for an animal is to be owned by a vet. But my dog knows if it gets stuck in the car, it's going to the clinic for something. It hates it. If it gets into my car, it says, no, thank you.
Something's happening.
Yes, because the only time it comes for a drive in my car is because I'm going to a clinic. Now, why are you taking me there? That it is there, and, that's why people should bring their animals to a clinic, even if they don't necessarily need to do it. That's one of those things. And we can create fears in animals, which leads to longer-term problems down the line of trying to manage them, because as all our pets get older, and even for us as people, we need more and more medical care, and we're going to have more and more procedures. And if this is an absolute horrible thing for the dog, because something that happened earlier in their life, it's not worth it, because it becomes very difficult to manage some of those animals, and they can become aggressive and nasty, and it just becomes a bigger and bigger fight with it. So the one thing is training and start right with puppyhood, get them used to coming to a clinic. There are dogs, by the way, which we can remove tumors comfortably, little tumors with local anesthetic, calm, relaxed dogs. I often give them a little bit of an opioid or something to relax them. We do a local block, talk to them that are there, and it works perfectly. They're often older dogs. They're far more relaxed. They're used to this. But you go and get a puppy who's looking at what's going on and saying, I don't lie still. That's it. It makes the procedures far longer for them and for staff, because now you've got a moving target because they're moving all the time. And so you've got to weigh all these things up for how that animal copes for it, that it is there.
Absolutely. Good. Please, you explained it so nicely. So my other scenario, and you did touch on this a little earlier, the high risk or the high risk situation. So often we'll have the particularly things like dental procedures. Well, they'll go, no, my dog's too old. The anesthetic is a higher risk now. The fear of having any anesthetic or any procedure because they're fearful that they're too old, that age becomes the limiting factor. How do you to manage that case discussion with owners and explain, perhaps a nice opportunity to explain the things that you do in terms of monitoring these patients?
Yeah, age is not a disease. That's the first thing. It's happening to all of us. Yeah. We're all getting older. That it is there. So that's it. And you look at the oldest person to finish Comrades as well in their 80s, I think close to 90, something like that. They've done 90 Ks between Durban and Pietermaritzburg or vice versa, and they're fine. And you get, I just want to say a 60-year-old, but they frail. They've got senility. They just not coping with life. And so you get old animals, and then you get very old senile type animals as well. And is anesthetic a risk? The oldest cat I think I've ever anesthetized was in his 20s. The oldest dog has certainly been close to 18 or 19 years of age. They've all gone home and they've woken up perfectly, and there's not an issue with it. So age on its own is not a major risk factor. It does alter some things, because as we get older, we get changes in cardiac function, we get changes in kidney function, etc. And that's more likely where the risk is going to come, particularly from your cardiovascular system, your heart and your lungs, is where most of that risk is going to come. So that's why you do the consult in the beginning, make sure they're clinically healthy and that they're fine. Then it's not an issue, because dental disease causes pain and discomfort. And dental disease, if it's left unchecked, leads to other diseases. So it can affect heart function, it can affect kidneys. It's a chronic inflammatory disease, or a low-grade chronic inflammatory disease that you get in your gums, for example, bad gum disease. So we're improving quality of life by doing those procedures properly. And we're preventing other complications from happening. So there's an important part to doing that, and to do it safely for that dog. And old animals can be safely anesthetized. There's not an issue with doing their anesthetic at all. It's just about looking after them. And that, by the way, senility may influence some of our choices of drugs. So we may change some of the drugs we use to alter the effects that it has, because anesthetics dull mental function, and senile patients may take a little bit longer to recover, to be back completely to normal. So they can be more confused when they wake up, or have some delirium, for example, when they wake up. And hopefully by changing some drug combinations, we can reduce that, or reduce the incidence of it, so that they wake up with a more clearer head and get orientated a lot quicker, that it is there. They often need a lot less anesthetics than a healthy young puppy who's bouncing off the walls, for example. So we can start to reduce those anesthetic drugs. And then it's about looking after them. And that's the most important thing for all our patients that we do. Most important part of my job is not the drugs I give, but it's how I keep their blood pressure up, how I keep their heart rates normal, keep them breathing in a normal pattern so that they can oxygenate themselves and get rid of their CO2. Those are for keeping them warm, heating the environment. And anybody who's had a kid recently and you've gone into a neonatal unit will realize it's like a hot tropical paradise. Well, we should run our theatres like that. And once the surgeon's scrubbed up, I can turn the aircon to 30 and say, they say, it's too hot, turn it down. I say, here's the remote.
They can't do anything.
Yeah, that's there. So we can change the environment. So one of the clinics, we run the aircon at 28 degrees where we do dentals with all the old animals, because it keeps them warm. It's uncomfortably warm. It was quite funny. In winter, people used to come visit us quite often because it was the warm room and they were all cold. But we can change things to actually do those animals quite safely, that it's not a major risk over and above a younger patient. And I think people get worried about it. But I think it's also a myth that we perpetuate as vets as well. So I get a lot of it say, oh, it was too old, we can't do an anesthetic. Oh, it's too old, we can't do an anesthetic. And so we've perpetuated that myth partially ourselves in the past and said, oh, yeah, it is. And people talk about it, and as people talk, so you spread it through social media and social networks. But to me, it's not a major risk that they are just old, that it is there. And you've got to look at things. If they're a healthy old patient, there's really no reason not to do it. And we talked a bit about, for example, a patient who has advanced cancer, for example, and that. And I believe all patients have a right to die with dignity and a right to die with pain, be pain-free. And if you look at ethics, by the way, it's not correct to offer a terminal patient a procedure because, by definition, a terminal patient is not going to live very long. And it's not ethical to actually offer them anything else but comfort, palliation, that it is there. But we get patients who we land up doing very invasive procedures in the hope of trying to save them. And that's not right either. The British National Health, I think, spends £27 billion or something astronomical like that every year on patients who don't even survive 24 hours.
Wow.
Because we try to do life-saving interventions in patients who are terminal. There's one problem with this. There's no diagnostics to know if a patient's terminal. So it's based on feeling. And we all live in hope, by the way. This has been well studied in people and so on. People will always believe the best in something. And this was done with Hodgkin's lymphoma. It has a 95% mortality in people. Hematologists in the human field diagnose it. They had a discussion with the patient, said, you've got a 95% chance of dying. And they sort of leave the story there, and they pick up the story later on when they looking at the next of kin and their later family members. And the later family members come and say, oh, he's got a 40% chance of making it, which we know the stats are 95%. They haven't changed lots in recent times. That's it. So how did it get to 40%? And they then go back and you follow the discussion and you realize the patient starts talking to their next of kin and they start upping the percentage because they want to be more hopeful, and it gets to like 10% and this slowly increases up, and suddenly you land up with almost a 1 in 2 chance of surviving a disease which you're not going to survive. Most of us are not going to survive. And we always look at the hopeful side of it. But in some ways, sometimes with geriatric animals, we've created the opposite story. And that's not true either. So we need to be more optimistic. But you can safely do geriatric anesthetics. It's a very, very safe, as long as you're safe. The safest thing is your anaesthetist. So a safe anaesthetist, not medications or drugs. And it's all about just looking after them.
And what about the home care? What can owners do? You talk about the recovery period. Obviously, that's the initial recovery period is under sort of a professional care. But they often say for an elective procedure, they're sent home. What are the kind of things that owners can do to aid recovery and to manage them post-anaesthetic?
So if anybody's ever had a blind dog, by the way, don't move anything in your house. But dogs, in actual fact, appreciate, and cats as well, it's incredibly important for cats, their smells and their pheromones and their marking. And it's one of the things we do in practice because we clean cages out. We put chemicals in it to kill all the bugs. It always smells foreign. And even simple things like that in cats, for example, leave some of their bedding. As long as it's clean, you dry clean it, as long as there's nothing else major on it, because it smells like home. And that can be very comforting for cats, for example, in their clinics. Instead of cleaning the cage every day, new bed, new linen, new everything smells new. It's a totally foreign environment for that cat that you put it into it. The same is true of dogs. I'm sure everybody has their dog. It has its favorite lying spot. You buy it a new bed and it ignores it. I got a friend who recently bought a new cat scratching pole. The cat sits on the old buggered one because that's its home.
Say, usually the couch.
It hasn't moved to its new abode because that's foreign to it. So the first thing is giving animals that, because that actually gives them a lot of comfort. Having their own creature comforts, but their smells and comfort. Keeping them warm. So put them in an environment they're warm, especially important in winter or when it's rainy and the weather's cold. Put them indoors where it's warm, where they're out of a draft. They are a bit sleepy, which does affect their ability to maintain temperature, but we want to keep them warm. it is there. So that's very important for owners to do. Encouraging them then once they wake up to eat and drink. And nausea, you can often have nausea after an anesthetic, and that's important. That's part of that discussion with your veterinarian. Do we give it treatment for nausea before the anesthetic, for example, or after the anesthetic? But if your dog's reluctant to eat and it's salivating, for example, well, then we need to give it something for the nausea. And we can send clients home with tablets to do it, or we can treat it beforehand, but it's to look for that because it's actually important for them to start eating and drinking again in a normal fashion. And especially our older patients, for example, with renal disease or advanced renal disease, we often keep them in a hospital till they start eating and drinking because we don't often see a lot of the drinking. But if they're eating, we know it's very likely that they're going to drink more than enough, by the way. So that certainly is there. So getting them back into that type of routine, getting their nutritional intake, there's often treatment for pain and pain control, so they need to keep going with that. And that's about being humane, which is one part I always say, like giving analgesics is good for humanity, but it's not the reason to give it. Giving analgesics is about controlling a stress response. And if you lived in a flight and flight response 24 hours a day, you will die. And analgesics allow us to manipulate that stress response and make it far less catastrophic for the animal. And then they may need their antibiotics, for example, some other treatments that are there. And if you have animals with chronic disease and they're on regular therapy, keeping that routine is absolutely vital. So if they have heart disease and they're on something like pimibendin or furosemide or one of the ACE inhibitors, for example, keeping that system going is very, very important because the stress of anesthesia can make their heart disease a lot worse. So we need to do something about that as well.
And how long until they can resume normal activity, for example? The dogs are obviously back perhaps generally in the afternoon when you discharge them from our care, but when can they go on their next dog walk, for example, if that's what's part of their routine?
If the dog's come in for a simple scale and polish, I'm just going to say we've cleaned his teeth, goes home the same day, there's no reason that the next day it cannot carry on its normal lifespan. That is there. And it's two things. So humans, we tend to limit our activity a lot more. Animals have no idea what happened or why or what to worry about. They want to do it. And mobility and movement's important, by the way. It's absolutely vital, especially even in old dogs. Movement's important. The classical friend of old people is pneumonia, very preventable disease by activity. And keeping that function is important, and keeping that stimulation going. And I often equate it, so this is a study that was done in human kids. I can use that because they're experimental in a hospital in Canada. They have this hospital, by the way, it's one of the best children's hospitals. It's got a theme park built into the middle of it, by the way, just that you know. But they took cancer kids, unfortunately, with terminal cancer and left them in the hospital staring at a white ceiling, electrical light bulbs, or they let them play in the theme park. And they watched how painful they were. And they had all the stimulation in the theme park. They used way less analgesics than the one left in a hospital room. And keeping animals active and so on actually helps a lot for their whole rehabilitation, their mental well-being that's there. So I always encourage movement and getting patients active as soon as possible. But just bear in mind, if they've got a fractured leg that we've repaired, that's not going to happen. So they're going to have far more limited activity, but they can still have the family environment and sit on the couch with you, watch TV, etc. That is there. They may not be running and going for long walks until that heals. And that may take 4 to 6 weeks before they can resume that type of activity. Wounds and that skin wounds that you've stitched up, you don't want them to rupture the wound at all. And that often takes somewhere around about 10 to 14 days to settle down. So you want to restrict their activity, in that case to protect the wound, but you don't want them to sit dead still for a whole week. You've got to keep that stimulation going. The same is true of cats. Cats will self-limit their exercise to some extent because they are lazy. No, not really. But we often land up unnecessarily limiting exercise, I always feel. Patients need to move. I really do believe that. And I encourage a lot of my patients to move early, especially if they're minor procedures. We've taken off a little lump and bump in the skin with local anesthetic. yes, you can't go swimming. So just bear in mind, if you've got skin wounds, you can't go swimming till that wound's healed. So there's no swimming for the next 2 weeks, but you can still go walking. There's no reason that you can't go to the park. And that's what I ask people, like, what happens in the park? Because, I let my dog off lead when it goes swimming. Well, that the day after surgery is not a good plan, by the way. So, but if it's things like that, it is, and does it chase all its friends? And you get some dogs, like some of these old dogs, they go to the park and they just waddle around, smell the trees, look at their friends, and they're not active. And then you take a puppy to the park and it just runs from one side to the other. And if it's got something like that, the consequences are very, very different. But I do encourage movement always very, very early on.
I know we're running out of time and there's so much to discuss, but my final question for you is your view or your advice on medical aids, because often, and I'm going down this route as our closing discussion, because often there is a feeling that anesthetics and surgical procedures are expensive, prohibitively expensive, and that's often why I'll get the owner come and say, can we not just do this without an anesthetic? I understand that sometimes it's led by that the financial sort of implications. Medical aid, advice on saving up. What are your feelings on it? Just a personal view.
So if you look at anesthetic costs and you look at analgesic costs, by the way, anybody who's in human medical aids, you'll know they never really query the analgesic drugs you go home with. Have you ever noticed that? No. They just pay for it. No, there's no questions asked. And the reason being is they actually make up a fairly small portion of the bill, but their benefits actually far outweigh. So it's good money. It's actually good money for them to spend. I mean, if you look through major surgeries, anesthetic bills are actually quite a small percentage of the total bill. So anesthetics play a role in building that bill up. There's no doubts about it. But usually as a percentage of whole things, they're actually quite small. So medical aids improve people's access to healthcare, and there's no doubts about it. So all the pet medical aids help dogs and cats get a whole lot of more procedures which the owners can't afford. I always say, like, the way they work, it's pooled funds and it's shared out. So the reality is you're paying for the procedure over a longer period of time. And when you need a large amount of money, it puts it forward to it. And all the medical aids are different, by the way. So some are better, some are worse. It also depends on the plan that you've got. But most of them, well, certainly from my perspective, is nobody's ever queried the anesthetic. Nobody's ever said, your dog's come for a cruciate repair. Oh, no, we're not paying that for the anesthetic. They're quite happy to pay for it because it's absolutely important. And it's, as I say, if you look at the global perspective of a lot of other bills, it's actually a fairly small percentage. And the humans, they use it that usually the entire anesthetic analgesic bill for a hospital stay, so the whole thing, if you have something major done, is usually only about 5 to 7% of that bill. Believe it or not.
I didn't know that.
That's actually quite small.
Wow.
I mean, if you think about, like, you take a dog, a fracture with bandages and all the other things, you add up that whole thing that's there, diagnostic imaging, for example, the blood tests, you take all those other things off it, it's usually a fairly small percentage of the bill, which is why they also don't query too much about it, just so that you know. So it is a fairly small percentage of that bill. But it helps you pay for other things in those patients. And so that has tremendous benefit. If you look at pet medical aids across the world, they've helped owners and pets get care that the owners wouldn't have been able to afford at that point in time if they actually asked for it or wanted to do it. And it's actually up to us as vets to do that as well. Every person wants to know that they've done the best for themselves, for their pet, that is possible for them to do it. And sometimes I see clients and we offer them magical things. And the more magical it is, by the way, the more it's going to cost. It's not always fair to actually offer those things because people then have the feeling afterwards, oh, I couldn't afford this, but it could have saved my dog or my cat's life, for example. And it may actually not be fair to every time offer everything that is possible. And this is a totally tangential discussion, but there's the ancient Greek philosophy of the doctor knows best. And I don't know what people out there's experience of doctors, but often you go to the doctor, you say, this is what's wrong. How much of a discussion does he have? He says, well, this is what I would do, and here's the script, and you walk out. So that's sort of the ancient philosophy of the doctor knows best, by the way, to put into it. Veterinary science, we've swung, which is part of what informed consent is, very much the other way to say, well, we can offer you these things, but you need to decide. And puts a lot of pressure on the owners. And now you say, well, here's the Rolls Royce. This is what your animal needs. It costs what a Rolls Royce does, and they can't afford it. And medical aid helps you pay for that Rolls Royce. And that's a great advantage, depending on the plan you've got, but a lot of them will do it. Or they'll pay for the little VW buggy that is there, and you've got to come up with the difference. But it's also about saying, cool, these are options that we have, and to lead them down that discussion. And so medical aids actually help them a lot in that type of discussion. But it's also incumbent on us to say, what is fair for this animal to go through? And that's, by the way, that comes back to that informed consent discussion right at the beginning. These days, certain medical aids, you can get a lot of pre-approval, which is really nice. Owners know what the medical aid is going to pay before you do, especially for the elective procedures. So dentistry, for example, cruciate repairs, a lot of that spinal disease, we can often get approval quite quickly for it, etc. So those type of things, and it actually helps the owner. And it helps that discussion where they say, how am I going to afford it? Well, you don't need to pay for everything. The medical aid does cover a large portion of those costs.
Absolutely.
And I think it's important for owners to do that, that it is there.
Thank you. Thank you so much for your time.
It's been a pleasure.
Fascinating conversation, and I'm very appreciative.
No.
You're an incredibly busy man, so
No.
thank you for taking time out of your
No, it's
hectic
an
schedule.
absolute pleasure.
I think it's been hopefully really informative for the listeners, and I've certainly enjoyed our conversation there. I mean, we could go on for days and days and discuss. I mean, you are a wealth of knowledge, so I love it.
I just get sidetracked.
No, that's brilliant. So thank you, Dr. Kenneth
No, it's a
Joubert.
pleasure.
Thank you. Thank you for joining me on this episode of the Paws Effect Podcast. I hope this episode has provided you with some valuable insights and helped alleviate some of your anxieties you may have about your pet undergoing anesthesia. Remember, the safety and well-being of your pet is our top priority, and the understanding of these processes is crucial for making informed decisions for their care. If you found this episode helpful, please share it with fellow pet lovers, subscribe to the Paws Effect Podcast, and leave us a review. Your support helps us continue to bring you the expert advice and knowledge you need to keep your pets happy and healthy. Until next time, take care of your pets, and don't forget to give them a big hug from me. Welcome back to Just for Pets. You're with Dr. Kara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help, and maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today, and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.